tend to not eat a lot, but when I'm feeling depressed, I overeat, I emotionally eat. Give me that bag of cookies and that bag of chips, and I'm going to be okay. Yeah, when it comes to my sleeping habits, that also changes if I'm in a manic or a depressive phase. If I'm in a manic state, I tend to not sleep at all. If I do happen to sleep, I only get about a couple hours of sleep a night. Don't need naps during the day, but if I am depressed, even when I'm not sleeping, it's really hard to get out of bed. So that's a great example of how it can change. Maybe it's confused thinking. So maybe they are feeling out of touch with reality, or maybe they're having extreme paranoia. They're in a euphoric state. There's different things where this can happen in multiple mental health conditions. Maybe they're using substances to cope with the intense feelings that they may have. So this could be self-soothing techniques, or maybe it is an actual mental illness. And then the last two, they go along usually with schizophrenia or schizoaffective disorder or bipolar. So they're seeing, hearing, or maybe feeling things that aren't necessarily there. And then lastly, suicidal thoughts. This is something that I always really like to hone in on, that suicidal thoughts or suicidal actions or ideations are something that's really important to take action on. You would rather be safe than sorry, whether you know someone is joking or not joking. We do have the chance to change a life and save a life when we come across someone that may be experiencing suicidal ideations. Different things that you can do is someone is talking, thinking, or making a plan to attempt suicide. One of the greatest things that you can do is call 988, which is going to be the mental health crisis line. Just like 911, same purpose, but it's going to be 988. So write it down if you haven't heard of it. Calling 988 so you can get those immediate mental health resources. Don't leave that person alone. It's definitely okay to ask, are you thinking about suicide? Because that gives you either a yes or a no answer, depending on what to do next, even though it is a tricky situation and it can be scary. Okay, so myth or fact, mental health conditions don't impact most people. I didn't even think about it, but I cannot see the chat since I'm sharing my screen. So I'm just going to trust that you are all putting in myth or fact in there, even though I cannot see. So mental health conditions, or mental health in general impacts everyone at some state or at some point in their lifetime. However, when it comes to mental illness, we already deciphered that they're two separate things. 1 in 5 individuals live with a mental illness. And then out of that 1 in 5, 1 in 20 live with a serious mental illness. When you think of a serious mental illness, you will most likely think about bipolar disorder or schizophrenia. However, the myth that we're going to debunk now is that anyone that lives with a mental health condition, they can live with a serious mental illness. It just depends on how they're able to function on their day-to-day life. Are they able to do activities of daily living? Are they able to contribute to society fruitfully? There's a lot of different things that come into play with it. So even though like I live with bipolar disorder, which can be considered a serious mental illness, I'm still living pretty well because I'm able to do my activities of daily living, hold a job. I was able to go to school when I was at that age. So there's different things that come into play with that. Now let's talk about youth. So 1 in 6 youth, they experience a mental health disorder at some point within that year. Let's break that fact down a little bit smaller. So 25% of mental health diagnoses begin within the early teenage years. In your early teenage years, you are going through puberty, which causes chemical imbalances and hormones, which can lead to the onset of a mental health diagnosis. The biology in the brain is definitely a factor that can contribute to a mental health diagnosis. And then the next 75% are usually diagnosed in their early 20s. I didn't know this until I received my bipolar type 2 disorder diagnosis when I was 24. You actually go through another set of puberty where your chemicals and your hormones are changing in your body once again. So not only do you have that second set of puberty going through all those chemical changes, you usually are having a lot of life-altering events that are going on during that stage. Now we have all these facts, we have all these statistics about how common mental health conditions are. However, one of the sadder facts about this is that it usually takes 8 to 10 years where someone is starting to show warning signs and symptoms of a mental health condition to receiving treatment or even the proper diagnosis. When I was in my early teenage years, I was diagnosed with anxiety and depression, which was great. It gave me the help that I needed. However, as I got older, I started to show warning signs of bipolar disorder. So that's another thing that can happen is that as you age or you go through different life circumstances, your mental health diagnosis may be able to change. But once again, it took me about 8 years to receive a proper diagnosis to get the right treatment. Okay, myth or fact. Mental illnesses can be caused by multiple factors. This is a fact. So mental health conditions have a lot of different contributing factors, whether it's a protective factor or a risk factor. Usually it's a risk factor that has an onset of a mental health condition. So maybe it's something that runs in your family. Bipolar disorder doesn't run in my family. However, mental health conditions do. My dad, he lives with a mental health condition. I have cousins that also live with schizophrenia. So it is something that does run in my family. However, I also think that it is an unlocked gene that other people in my family have, and it just like hasn't come to surface yet. The biology is the different neurotransmitters that are in your brain. I am very fascinated by neurotransmitters and different synapses within your brain and if they're firing properly. If they're not firing properly within your brain, then the signals of trying to like live well or emotions, whatever that may be, they're not getting to the right neurotransmitter. So if they're not getting to the right neurotransmitter, then they aren't getting the right connection, which can lead to a gap within our mental health that can lead to a mental health diagnosis. Trauma is also a huge one. Trauma is also known for altering the biology within your brain. Depending on what happens, it changes your genetics as well. For me, I also went through a very traumatic experience before being diagnosed with bipolar disorder. So trauma can come in multiple ways where it either impacts the biology, it impacts your emotions, or lastly, it can be hereditary from there on out. I don't know if any of you have heard of generational trauma, but if you have not, go look up generational trauma. It kind of gives a better explanation of all of this. And then lastly, environmental stressors. I like to call this our basics, our basic needs. So are you getting enough healthy food? Are you in a neighborhood that is safe? Are you in a healthy household? Are you in a food desert? So is there anything that is impacting your food, water, your house security? Are you in healthy relationships? Different things like that. So kind of the hierarchy of needs is what I like to say goes into the environmental stressors. Okay, people with mental illness can't work. I really hope that you get this right because I'm standing up here talking to all of you today. And guess what? I am working. Okay, so this is a myth. So, however, even though we live with mental health conditions, we are just as productive as anyone else that is within the work field. We have just as good as attendance. We're very punctual. However, I'm not that punctual, but usually majority of people are. We have a creative brain. We use different parts of our brain that may not be activated in others. So it can be a blessing and a gift, even though it is hard to live with. When you are taking care of your mental health or your employer is taking care of your mental health, it's two ways that are fantastic. That one individual who works for that company, they're living well, they're able to attend to their job and actively participate in their job or whatever their work duties may be. But for the employees or the employers, it's also a win-win for them where they have lower medical costs, the increased productivity, lower absenteeism, and then decreased disability costs. Depression is the number one disability within the United States right now. Another thing as well is that if someone were to take short-term or long-term medical leave, which can be due to someone's like mental health, the employer still has to pay for that. So it's kind of like a overall round circle of you're taking care of your employees and they're also taking care of you. Okay, most people have access to treatment. This is a myth. Let's go over some specific Texas statistics. It's a nationwide problem. It is something that a lot of Americans do face with having access to treatment, quality treatment, or even having a proper diagnosis. So it's not just the state of Texas, it is an entire pandemic within the United States. But I think since we're all Texans, let's talk about Texas a little bit. So more than half of Texas psychiatrists, they are between the age of retirement. And if they're in between the age of retirement and there's a shortage of medical providers, psychiatrists or psychiatric nurse practitioners or physician assistants coming in to school, and we have individuals retiring, there's a big gap still of where we don't have enough people to fill those positions. People are wanting to go to school for that long, or maybe they are going to school for different purposes because they just don't want to get into that field. So there's already a shortage of individuals that are coming into the mental health field. So we have individuals leaving. 200 counties in the state of Texas, they do not have a psychiatrist. They may have a counselor or they may have another type of mental health provider, which could be their primary care provider who is able to help them with their mental health. But really the best person to go to receive a mental health treatment is a psychiatrist. There is telehealth available. However, there is another statistic where 1 in 20 individuals that live within a rural community, they don't have access to sustainable internet connection. So if they don't have access to sustainable internet connection, then they're not able to receive those telehealth services. If they don't have proper or adequate transportation, then they're not able to leave their county to maybe go to a neighboring county to receive mental health treatment. So they're kind of put into a bubble where they don't have access to care. Even if telehealth is an option, that's not an option for everyone. So 1 million Texans are without insurance, and if they don't have insurance, that really decreases their access to mental health treatment. I will give an example of what it was like when I moved here to Texas. I was 26, so I wasn't on my parents' insurance. I had to wait until my insurance kicked in here at NAMI, and what did that time frame look like for me within those 3 months since I didn't have insurance? My psychiatry appointments were $500 for one appointment. I see a psychiatrist once a month. Each counseling appointment was $125. I went from seeing a psychiatrist every week to every other week. My antipsychotic was $1,500, which is a lot just for one medication. And then other medications that I had were ranging between $200 to $300. So my total mental health treatment just for 1 month costed about $3,000. I don't know about you, but that is my monthly pay. So it had to come down between, am I going to be able to afford food and housing, or am I going to tend to my mental health? So mental health treatment, it's not cheap, even when there are low or no cost affordability options out there. It's not the same for everyone. Another thing is that we are pretty lucky here within the Central Texas community with outpatient psychiatric services. However, with the entire state of Texas, they don't have as many services. So 2/3 of primary care physicians, they can't secure outpatient mental health services. So it could be a day program, it could be a hospitalization, it could be partial hospitalization. But once it goes beyond that primary care physician, it's hard for them to secure services for that individual to get well and live well. Kids don't get mental illness, myth or fact? Okay, so we already talked about the 50% of lifetime illnesses begin by the age of 14. One thing that we should touch base on, though, is suicide is the second leading cause of death amongst youth. Accidents are the first leading cause of death within Texas. I don't know of that specific statistic off the top of my head, but I also know for adults it is within the top 10. So these statistics, they are pretty high. It is something that we would love to lower down and have it not be as common as unfortunately it is. But when people are thinking about suicide, it's because they see that there is no other answer. So that's why mental health support and mental health services are really, really important. All right, so let's talk about the school to prison pipeline. So 50% of students with a mental illness drop out of high school. When they drop out of high school, usually they become involved within the juvenile justice system. And that's going to be a continual cycle over and over for them, where it's either going in jail or prison or maybe a psychiatric hospital or being homeless. So the school to prison pipeline is also a really cool thing to look up just to have some extra like knowledge in your back pocket. Okay, individuals with a mental illness are more violent. This one is definitely a myth. Oftentimes people think that individuals with a mental health condition, we are more violent than those who are not. Even though some illnesses do increase a person's risk to commit crimes, such as them being paranoid or schizophrenia, or when they're in a manic state. It could also even be small crimes such as trespassing. However, when it comes to mental illness, there tends to be a zero tolerance policy with the community and not also law enforcement. There's also, due to lack of knowledge, where it is that individual who may have committed like a small crime such as trespassing. There's a lack of a mental health crisis response, so automatically they go to jail when they could be receiving mental health crisis services instead. Violent acts, they're committed by people without a mental illness, regardless of what social media says or the news, whoever it may be. Oftentimes you only hear about the crimes, the violent crimes that are committed by someone who lives with a mental health condition, but usually we are the victims of a hate crime. It's about 8% are actually individuals who are committing a violent crime, but usually we're the victims. Okay, there's a significant link between physical and mental health. This one is a fact. The mind and the gut, they do go hand in hand. There are microbiome within our digestive tract, which regulates our immune system and also helps regulate our emotions. So it's something that is quite interesting to also look into, is that when the microbiome is off in your gut, it can impact your emotions. And when your emotions are off, it can impact your autoimmune system. So they really do go hand in hand, even though we are part of the same body. There's some scientific truth behind it. Another thing is that physical chronic conditions can lead to someone struggling with their mental health because they have maybe an impaired ability to do whatever they used to be able to live. They now have to adjust to what life is like with a chronic illness. And then also at the same time, if someone is living with a serious mental illness, they are at higher prevalence for a heart condition, a stroke, diabetes, different things like that. So it's really important that we take care of our mind, our body, and our spirit. And I like to say our spirit is what gives us that purpose. Okay, so this is also going to be a myth or fact that Eric is going to include within his story, is that people with mental illness don't get better. And I hope you also get this right, because I am also here standing up and talking to you. It is a myth. It is extremely important for individuals to seek help. Seeking help, it can look different for everyone because it is not a one-size-fits-all approach, and it can be a trial and error for that reason. However, it's also something that is going to continue to change as someone gets older. It's going to be continual. It's something that they're always going to actively have to work for. But help can look different where it's psychological. So that could be talking to a mental health professional. It could be social, such as going through and finding different social connections or a support group, or getting out there and trying to build friendships, just being around people so they're feeling less lonely. Peer support, which is where NAMI Central Texas comes in, where we have amazing support groups on a weekly basis. We have 8-week recovery courses. And not only are we serving that peer, that individual who lives with a mental health condition, we also have programs for their loved ones. So their family members, that could be blood relatives, it could be spouses, partners, it could be close friends, anyone who is within that support circle of that individual also has access to our programs. And lastly, the biological aspect. It is something that some people, they like taking medications, and some people don't want to take medications, which is totally okay too. There's other options for them, but the biological aspect would be taking some medications. There are a lot of barriers to accessing these different treatment options, and that's one thing that NAMI Central Texas is actively advocating for within the community, is making these barriers smaller or easier to overcome. We also provide additional resources if someone just needs that connection to finding a way to live well. If you have any questions about mental health, you want to attend our programs, or maybe you need additional resources such as seeing what other mental health providers are in the community, maybe you need connections to a food bank or maybe housing, we're able to also be that middle ground for you. You can see our website where you can access all of that information, our email, and then also our phone number. We also have socials where we're actively posting positive, uplifting things, mental health facts, and then all the programs that we offer. And then we recently just started a TikTok where you can see the funny things that go on in the NAMI Central Texas office. I'm now going to